So, as both a physician that takes care of patients at the bedside and a physician researcher, the whole world has turned its attention to this problem. Currently, for COVID 19, there really is no specific treatment for it. This is a drug that is an unapproved drug right now. It's an experimental drug made by a company called Calcimedica, CM4620-IE. And it was originally developed for acute pancreatitis, which was what we have been testing it with. What we noticed during some of the initial trials that it had enormous anti-inflammatory benefits, and especially with patients and had low oxygen levels. We began enrolling patients last week. We hope to enroll 60 patients, 1, 2 patients a day. So this is on the order of weeks, perhaps a month or two. As we're able to flatten the curve here as Minnesotans, we may see less hospitalizations, and that's good for us as a state. Might mean our study takes a little bit longer, but that would be a good trade-off. What I would consider a success is if a patient that gets admitted to the hospital with COVID 19, which already means that they have a certain amount of low oxygen and a certain amount of difficulty breathing, that this medication would perhaps reverse that need, that they might need less oxygen, that they might have less difficulty breathing, and most importantly, prevent progression of that disease. Perhaps less people dying, perhaps going home from the hospital earlier. All those would be positive outcomes if we should see that in the experiment. Our medication is not a cure type drug. Our medication is for those that have it becoming less ill, is our theory at least. But I do know that this virus will succumb to our human ingenuity in one way or another. And it is exciting to participate in that. And I can't wait to see how we beat back this coronavirus.